My name is Sean Fraser, and I'm a founder of Pinnacle Health Informatics. Pinnacle Health Informatics was formed as a result of a need for improved data and analytics in the behavioral healthcare space. We've been working in behavioral healthcare since the late 90s, so quite a while now. And we've worked in all aspects, IT, infrastructure, data center support. But we noticed in those early years, in the 2000s, that there was a real need for improved data and analytics. Our goal was to make data accessible and easy and actionable and make it so non-technical people could access their data. So we created tools that are extremely effective and time-saving and allow people to get their jobs done and analyze data and take action on their data rather than hunt for data or look for data. It's like magic. They are able to make better decisions, treat patients more efficiently, have better outcomes, and overall the organization runs better with a higher level of patient satisfaction, and the people who are in charge of getting data are much more productive. Our flagship product we call the Pinnacle Data Warehouse, and it integrates data primarily from the electronic medical record of an agency. And we work with many different electronic medical record vendors: NetSmart, Harris, Integrative, Credible, Qualifax, Epic, NextGen, InfoMC, Athena. Any modern electronically stored data system we can extract data from. People can be up and running and productive writing dashboards and reports within a matter of just a few hours of training. And it's really led to a huge improvement in productivity for data professionals and those who create data tools. We've seen new employees come into agencies, and within a day, they're writing complicated reports out of our data warehouse. It just changed everything, a complete game changer. We've seen people save thousands of hours in their agency over the course of a year because they're not spending hours and days hunting for data and trying to understand the data. Instead, they're immediately productive. And it's a huge time saver, a huge productivity booster. Data gets into the hands of the people who need it. We've had data analysts who were spending 2 to 3 days per week assembling spreadsheets, getting data, manually entering it into systems for board meetings, for weekly board meetings. So they were spending 20 hours a week just getting data put together and in a manual fashion. And we sat down with this company, and within a couple of meetings, we were able to source all of that data out of our data warehouse, put it in a tool that they could just refresh with one button. And just like that, we gave a person 20 to 30 hours a week back in their job. And that person was extremely grateful. That changed their whole life. They could get their job done. They could get home on time. They had their board reports ready. They walked into the board meetings, hit refresh, there's all their data. Life-changing, really, for these people. And we see that over and over again. People just spending hours and hours and hours trying to make their way through data. And we try to give them a tool that they can just refresh with one click, and off they go, making decisions. We have a deep knowledge of the industry. That's really important. We have a deep knowledge of behavioral healthcare. Behavioral healthcare can be very complicated, all the regulatory components and requirements. We understand the challenges that the data professionals and the administration of these agencies face because we've worked in them. It's very accessible, it's very familiar, it's easy to use. It's very fast, it uses familiar tools, and people can become productive right away. And then we combine that with a deep knowledge of the industry and really an interest, right? We really care about behavioral health. We care about our clients. We have a deep engagement with all of them. We don't just train them and say, see you later. We actually have very frequent calls with our clients that we're constantly in communication with them. about projects that they have on the docket and how we might be able to help them out. That's very, very common that we are a deeply integrated team member with all of our clients in helping them. So it's a deep interest, enthusiasm for the product, and then just a high level of productivity and speed